Statement of fact number 14. Dr. Buttar charged thousands of dollars for his treatments. The total cost of his treatments and therapies for these cancer patients ranged in the tens of thousands of dollars. Dr. Buttar ordered numerous tests and lab work for these patients that had no rationale, medical relationship to the patient's cancer diagnosis. Well, if you think that looking at natural killer cell levels, looking at lymphocyte subpopulation, looking at apoptosis and cell cycle analysis, looking at some of the conventional cancer markers like CA125, if you think that those tests are irrational, or looking at the cortisol levels and seeing how much stress the patient's under, or looking at the conventional labs to look at how well the kidneys are working, the liver is working, if you think that those are all useless tests, then the medical board would be correct. But the medical board is incorrect, because those tests are very necessary in order to do the types of testing that we're doing, in order to do the types of treatments that we're doing. To give you a point, in fact, just taking a normal person that doesn't have cancer, just a person that has heavy metal toxicity, and we decide to do what we call anion surfactant treatment or chelation therapy by removing the metals. Did you know that Medicare will pay for this? Medicare will pay for this in a hospital, and they will pay a couple of $1,000s to do this treatment, but they do it in the hospital because they say that it needs constant monitoring. Now, according to the medical board, these tests were useless, but this is the same test that the hospital will charge $2,500 or $2,800 for to do under constant monitoring, that we do on an outpatient basis, and that we do some tests to make sure that the safety is being maintained. And the medical board says because we're only charging $150 for the IV, we are doing frivolous tests, but the hospital can charge $2,800 for the same treatment using doctors that have virtually no experience in this type of treatment, and then it's okay because it's being done in the hospital environment and you're charging $2,800 for it, and then you need continuous treatment. The hypocrisy is absolutely ludicrous. Do your own search. Look and see that Medicare and Medicaid will pay for chelation therapy if it's done inside a hospital, inpatient. They also go on to say that we charge thousands of dollars for treatments. Let me tell you about our treatment costs. If you go and get conventional treatment for cancer, get chemotherapy and radiation therapy, our charges are below the charges that were conventionally charged in 1999 for the standard chemotherapy and radiation therapies. Except the only difference is with our treatments, people don't lose their hair, and people don't become nauseated, and they don't become their immune system doesn't become suppressed. Our treatments actually make a person feel better, stronger. Is it effective towards cancer? Absolutely it is, if we can reduce the toxic burden substantially enough. But sometimes when the patients come to us, they're already too far gone. The fact that we've been successful in some of these patients when everybody else had already failed, all the chemo and the radiation failed, that's what they should be looking at. And rather than looking at that fact that our successes, however limited they were far greater than their successes, because by definition, every one of our success was already one of their failures. They don't come to us till they've already failed everything else. So for them to sit here and try to grade my therapies or my philosophy according to their methodology is absolutely ludicrous. We've already gone beyond that point. The patient had already been told that there was nothing left for them. That's why they came to us. And you've seen some of the videos, and if you haven't, I encourage you to look at some of the videos of the patients and what they've said, despite the fact that they were told that there was nothing else that could be done for them. It's all about the patient's choice. They're basically saying that if a patient's been told by an oncologist that there's nothing else that should be done, that patient should go home and plan on dying, because that's what the patient is entitled to. They're not entitled to have a choice of finding somebody else who's not willing to give up and who's willing to try to help them without making any guarantees, without promising anything, just being told that, look, we'll do our best, we don't know whether it'll work or not, but this is what we've done, this is what we do, and if you want it, we're willing to do it. And the fact that these treatments cost money, it's the government's fault because they're not reimbursing for that treatment. That's where the real crime is, that these treatments that detoxify the body, that reduce the toxic burden in a patient, that help to stimulate and re-stimulate the immune system into starting to become functional again, those treatments are not being repaid by the government for the patient. That's the crime. Sorry, but I'm pissed right now, as if you guys couldn't tell.